Lorenzo.
Lorenzo has a very big, bubbly personality. He is very happy all the time.
My son's name is Arush. He likes to look around. What's going on?
Lorenzo was born prematurely.
Arush, he had so many surgeries.
Lorenzo was in the hospital a total of 18 months. At this point, we are definitely ready to have him home and be a family.
Advocate Children's Hospital is dedicated to providing care for children with medical complexity.
Our kids have a lot of medical equipment needs as far as tracheostomies, ventilators, oxygen, pulse ox, suction machines.
Our patients really do need a team-based structure with team members that can provide different perspectives.
Dr. Luis Torrero is our inpatient physician that really handles a lot of the ventilator and technology-dependent children when they get hospitalized. Dr. Notario is a general pediatrician with a specialty in complex care for children. She follows these children in the outpatient setting.
The nurses in the pediatric ICU are absolutely amazing. They are the elite nurses in our hospital. They can take care of any child that comes into our unit, and they're also very patient and kind and comforting to the families who need it the most.
Arush was in the PICU for 7 months. I asked them if we can take him directly home from the hospital, and they said you have to prepare mentally and physically to take care of the baby.
Our families want to take their babies home, and we provide them the partnership with Almost Home Kids to learn their care in a different way.
We see a wide variety of children at Almost Home Kids. We have children who are born prematurely with cerebral palsy, spina bifida, children with traumatic brain injuries.
Parents that are already dealing with an emotional transition to the home are now dealing with all of these complex medical issues. Almost Home Kids helps ease that transition and teaches them how to do these things on their own in their own home.
We come to Advocate Children's Hospital and have a discharge planning meeting with the family and with the team at the hospital so that we're sure that we're doing the same care here as they've been doing in the hospital.
Advocate Children's Hospital has a wonderful team of nurses and respiratory therapists that provide services through the transport team that maintains their stability and provides the final handoff before the patient stays at the next facility, such as Almost Home Kids.
Almost Home Kids is very home-like, and you get to learn a lot while you're here with your child.
Lorenzo's been with us for a couple of months, and he did training at the hospital with his family, so they came to us well prepared.
They have showed us how to draw up his medications. They've showed us how to put his feeding bags together, make sure that they're running at the right time and the proper rate. All the staff here has been very supportive.
We have a wonderful team at Almost Home Kids. We have RNs, nurses who are around-the-clock care. They're PALS certified, which is Pediatric Advanced Life Support, as well as VENT certified. When families first come to us, they don't necessarily want to go home and sleep in their own bed the first night. So inside the Ronald McDonald House in Chicago, we have an Almost Home Kids, and families can utilize the facilities at Ronald McDonald House to stay. In Naperville, we're very excited that we recently built a parent suite, and parents can stay for the first couple of nights so that they can be closer to their child.
There are many different layers that are involved in caring for a child with medical complexity. It can be stressful for caregivers. We really encourage our families to take some time to themselves, and this can be in the form of respite care, which Almost Home Kids can provide.
We give the families a really solid foundation. The staff that works here loves the children and want the children to succeed. And you can really feel that when you come to Almost Home Kids.
Advocate Children's Hospital and Almost Home Kids have a wonderful partnership. We want parents to feel comfortable and empowered in taking care of their children in the home setting.
Victor and I are looking forward to having him home and being a family and going on family trips and having the holidays together and just being all together as a family.